So yes, hi, thanks everyone for coming to the March online supporter update. Let's start with a round of introductions from everyone, and then we'll jump into our presentation on medical respite at the POV. So hi everyone, my name is Sarah Penix. I'm the communications coordinator at the Poverello Center. My pronouns are she, her. Jesse.
Are we doing this favorite season as our?
Oh yeah. And then also we'll say what our favorite season is as well. And mine is summer. So.
My name is Jesse Jager, Director of Development and Advocacy for the Poverello Center, he, him pronouns. And it's a tie for me between spring and fall. I like those two seasons the best.
Hey, I'm Aicia, the Medical Respite Coordinator, Care Coordinator. She, her pronouns. Definitely fall, but like since spring is here right now or soon, I'm loving that. So, but fall, yeah.
Emma, and then if we want to just popcorn around.
Yeah, I'm Emma. I'm a social worker here at St. Pat's. I work primarily in the cancer center, but I also float to the inpatient units. And my favorite season is summer for sure.
Okay, yeah, excuse me. My name is Cook. Can I take my mask off? Because I'm within 6 feet of all of you, you know, and I hope my breath doesn't smell too bad. And I'm a tree doctor, and I'm the only doctor in town that makes house calls. Nobody brings a tree to my clinic. So if any of you have a tree on your property that's sick, give it 2 aspirins, but don't call me until morning, okay? And the favorite time of the year, every day of the year is favorite for me. I'm enjoying my old age and my second childhood. And I have no direct connection with the Poverello, except that I do provide transportation for several fellows who have some connections with Poverello. Okay.
Thanks for joining us today, Jim. Sarah Donahue.
Hi, everybody. I'm Sarah Donahue, she, her, hers pronouns. I am development coordinator at the Poverello, and I guess for season, I would have to say summer. All my hobbies and interests are sort of summer based.
Then Marilyn or Sarah Raz, you guys are the next. Marilyn, you're muted.
I always forget to pay attention to that. My favorite season is summer because I absolutely love the farmers market downtown.
Thanks for joining us today. Sarah Raz and then Connor, Linda, Cassie.
I'm Sarah. I'm the new development assistant. Today is actually my second day. And I use she, her pronouns. My favorite season is definitely fall. I love cool weather.
My name's Connor. I'm a reporter for NBC Montana here in town. He, him, and my favorite season is winter, hockey and skiing.
Hi, this is Linda McCullough, and my pronouns are she and her. I'm just a donor, and my favorite season is, I think September, I think fall, maybe spring and fall. Okay, thank you.
And then hi, Cassie. Would you like to introduce yourself?
Yeah, sorry, we're be dipping in and out. But I'm Cassie and I use she, her pronouns, and my favorite season is fall.
Thanks for joining us today, and thank you all for joining us today. We'll be learning about our medical respite program from Aicia and Emma. And with that, I'll hand it off to Aicia and get our PowerPoint queued up.
Thank you, Sarah. Yeah, hi everyone. My name's Aicia. I don't know if not everyone has met me. I started this position in September of last year, and before that, I worked direct care and was lead staff. Yeah, really love working at the POV, and I'm really excited that I get to do this now. So first, I'll just do kind of a quick overview what the program is, key components, statistics, then I'll give a quick update and a recent success story. So medical respite beds are available for by referral, only for people who need additional privacy and time to recuperate from a medical crisis. Most referrals do come from St. Pat's, and are surgery related, but then we also have many other refers as well. Let's see, we do have like some criteria. It has to be, an acute condition. They have to be mostly independent, since it is really only me and then the direct care staff helping them at this time. And then it does need to be the official referral from a medical provider. Yeah, and then we get most of our referrals, like I said, from St. Patrick's Hospital, or also Providence in general. And then we also have a very good working relationship with Partnership Health Center, who has a clinic in our building, as well as over on Railroad Street. And they're the next top refer and you can see the numbers just in 2021 that I put up there. And then Community Medical Center is third on there. And then let's see. And then we get a range of referring conditions. The most common is surgical, then followed by trauma or general injury, and then respiratory and infection are sort of neck and neck there. And sometimes clients get set up with partners in home care to help them with their follow-up needs. Anything really medical related that I'm not licensed to provide. Let's see, a lot of what I do is coordinate services for people. So the primary goal is to help them with their health and a positive outcome, and reach their health goals, which are usually laid out by the referring agency. But I will help them get to various, appointments, help them establish a primary care provider if they don't have one, help them, or if they don't have insurance, that's also a major thing I like to work on. And then if they're there in the program longer, sometimes I'll have time to help them with additional things. And I like to really focus on the goals of the patient, meeting them where they are, and seeing like if they're needing help beyond my scope, what other warm handoffs can I do to other agencies? And then also housing is a big one, really making sure they're on the appropriate wait lists, or doing certain assessments with them, and just really making sure like I'm having them set up for their next step. Let's see. Yeah, and so it's a range of things, and then how it helps the community really, since its inception in 2016, it's prevented more than 1,200 medically unnecessary days of stay in local hospitals, which has saved our medical system well over 2 million. I think 2021 alone, it was over around $400,000. And it's just it's a vital safety net for most of our vulnerable neighbors and reduces the length of stay, and readmissions as well. And just a great resource for the community in general. And then just in 2021, some numbers, we had 48 individuals stay, totaling around 1,400 total nights of stay. Average length is 28 days. And yeah, 225 days people would have been in the hospital otherwise. Yeah, and so just some quick I put a comic in there. It's not that funny, but this might be relatable to some people. Insurance is definitely my kryptonite. I don't often like to give like insurance advice. I'll get other professionals to weigh in on that. And so I just thought that was kind of a funny thing in there. Let's see, just some quick updates. We recently got a volunteer group in to deep clean the rooms. Since health is kind of number one, we want to make sure it's a clean, healthy environment. And we have those scheduled semi-regularly. And then obviously I also do in between stay cleans as well. And then we're also looking at maybe a process for extensions to be easier for referring agencies and help with our data. And then I'm really doing trying to do a lot of research on more holistic approaches to care coordination, really looking outside the box. And then something that's not exactly specific to Med Respite, but I think could help, is we have the Justice Department recently donated laptops to be used by everyone in shelter in general, but I do have quite a few patients who need to do like telehealth, and so having access to those laptops that I can provide them, yeah, is awesome. It's a good step. Yeah, and then we've had multiple success stories. A lot of times it's just that they recover from what they needed. But one that really kind of entails the whole program, I guess, and what it can offer is I recently had a client, Ben, I changed his name to protect him, but he was a recent client and he was referred by St. Pat's for a minor surgery. Ben is sight impaired and he was new to the area. His most recent living situation turned toxic and he was forced to move out. His main goal was to move here so he could be closer to his medical team. And we were able to get him signed up for paratransit. So he was making all of his appointments, which were pretty frequent. And just due to his situation, he qualified for many project-based housing opportunities. And recently he just got a call from Missoula Manor, and they said there will be a unit open for him, and he actually should be moving in this week, which is really awesome because he came to us in November and just got my ability to interact with him and find out like what his goals were and what his history was able to lead to that housing outcome. So yeah, but thank you guys very much. I think that's pretty much all I have to say, but if you have any questions.
Thank you so much, Aicia. Does anyone have questions for her at this point?
I have a question. I'm just curious, if the laptops are available to everyone, or are they assigned to specific individuals?
It's just we have a few laptops, and so I think the primary goal was so people could make their like court appearances easier. That's why they're provided by the Justice Department. So they just get checked out. They sign out, and they have to keep them in the building. But so yeah, not everyone gets one, but if they needed one, if they had something scheduled, we would be able to provide that for them. So I just thought that would be a really good tool for for medical respite. Yeah.
Yes, for sure. Thanks.
Yeah, and it was an exciting partnership with the Department of Justice that they provided a bunch of laptops. And when they offered them up, they're like, hey, this is gonna, through a grant to help people access their legal services and meet with their lawyers and stuff like that. But then they also said, we also know that these could be used for a lot of other things for your clients, and please do use them for things like medical respite or other things like that. So it was just kind of a win-win sort of deal that they're able to serve those up, and they've been really, really helpful for our clients in a variety of different ways.
Yeah, can you talk about how helpful those are, especially with the major component of telehealth being a big thing coming out of COVID?
Yeah, I mean, they're quite new, but I mean, before we have a lot of, okay, so Montana, I guess, or Missoula is kind of also a smaller city. So we do also have like a lot of traveling or outside doctor profession, like even before COVID, like, professional or specialists who, are just not able to be here physically. And so to be able to set that up for someone who has maybe who has kind of an immediate need to be diagnosed is huge. Like timing is very huge for people with medical, with probably all sorts of things going on. And so the sooner they can get seen and talked to and evaluated, the better. And so if you have to wait for that specialist to come in the 1 month they're in town, that's gonna hinder a lot of people, especially if they can't make that appointment that time. Or so it is a new thing, but I have had telehealth and done telehealth with patients in the past, and just helps them, better connection, I guess.
Sure. Yeah, no, you're good. Thank you.
I'm sorry, I have one more quick question.
Sure.
So Missoula Aging Services has some really good programs on Zoom.
Okay.
One is the Aging Mastery Program, and then there's another one like Healthy Bones.
Oh.
Do you think that would be useful to have that person
definitely.
contact you? Because I could suggest she contact you.
Yeah, I'd love that. They're really great over there. That's kind of what I was talking about with insurance. I'll get their advice on like Medicare and waivers and stuff like that. So I would definitely be interested in. It's always, we can always offer up those resources to people, and if they take them, that's great. Thank you.
Okay, awesome. Thank you all for your good questions. Emma, would you like to kind of talk about the referrer side of things?
Yeah. So like I said, I work mainly in the cancer center, but I also float over to the inpatient units. So the way that the referral process works on our end is first determining if somebody is experiencing homelessness, and then communicating with the care team as far as what their needs are going to be at discharge. Like Aicia said, a lot of it is surgical. One example was somebody that needed a wound vac. So they went over to a POV respite bed, and they were able to receive home health services. That person was also following at the cancer center, so I had the benefit to continue to follow them and then communicate with Aicia about different appointments, and she did a really nice job of making sure that they were getting here to their appointment. So that was just a great resource. We fill out an application that just asks a little bit about the medical needs, and the doctor has to sign off on that. We also send discharge paperwork over to Aicia so that she knows what's going on with the patient and what kind of follow-up needs they have. So yeah, we do a lot of communication with Aicia. She gives her stamp of approval if that is if it's going to be a good fit, and then they stay there, and she does a really nice job of helping coordinate outpatient follow-up. I think the biggest benefit is to get patients discharged from the hospital. Otherwise, I know she spoke to this a little bit, but it would really increase our length of stays because there's not a lot of options for somebody, especially if you're in between where you don't have housing and you don't qualify for a nursing home. It's a really great option to have that in between for somebody that needs it, and to get that extra support too for the follow-up care. What else? Yeah, just some other examples. I know I was working with a patient here at the cancer center, and he was staying in the general area at the POV, and he had an acute need in the hospital where he required oxygen for a period of time. So he was able to transition into the Poverello respite bed for the time that he needed, and then eventually transitioned into a nursing home. But yeah, it's a great program, and it's really, really beneficial to us as a hospital to have that option available, to not only decrease the length of stays, but also prevent people from coming back too. So, does anybody have any questions for me?
Is that kind of where you can get into that cost savings? Is like, it's a preventative model. So instead of someone not getting the care they receive, they would need more care at some point, and instead you get them into a program where you get to get them the care that they need?
Yeah, absolutely.
Cool.
Mhm.
Does anyone have other questions for Emma?
Well, and I'm just going to add one quick shout out just to say the whole team over at Providence has been such a great partner for the Medical Respite Program. Providence, St. Patrick Hospitals were a founding funder to get the program set up, and has been an ongoing supporter financially to the program. So I really appreciate that partnership with them and the great care providers over there like Emma and the doctors who spend so much time making sure that they get our most vulnerable neighbors into places like Med Respite. We really just appreciate that partnership moving forward as an organization.
And then if there aren't any other questions, I will pass it off to Jesse for some announcements.
Yeah, so I've got a little bit of a news that we wanted to share with the folks here on our online supporter meeting. This just actually got announced to our staff yesterday, but I will be moving on from the Poverello Center at the end of March. I'll be taking a position, the Director of Programs over at Home Resource, which is an organization I've been very involved with on my volunteer life for a long time. And just making this transition, there's a couple reasons for it. The biggest is kind of a need to downshift a little bit. I've got some family health stuff going on that I need to be paying attention to, and the POV needs someone in my role that can be in it hardcore every day, and that's just not going to be possible with balancing some of my family stuff. So I'm really going to miss the amazing staff at the POV, and then all you supporters that I've gotten to know over the last nearly 4 years that I've been working there, and just so appreciate the partnership we have in the community to help our most vulnerable neighbors, and I'm going to miss it coming here every day. So so just wanted to say thank you to those of you that I've gotten to know these last year. But yeah, my last day at the POV will be March 29th. I know that there'll be an announcement pretty soon about the position being open. So if you know anybody that you think would be a great new development director for the Poverello Center, please pass it on. They get to work with some really amazing people, like the 3 Sarahs on the call now. We've got 3 Sarahs on the development team. So so yeah, that's just so yeah. And I don't know if anybody has any questions, but that's what'll be up when you stop seeing me around. That's why. Unless you come into Home Resource, then I'll be there all the time.
Well, yeah, we'll miss you, but really excited for your new position at Home Resource. It'll be awesome. So yeah, just in closing, if there aren't any other questions at this time, I just wanted to alert you all, our next online supporter update will be April 4th, next month, and I'll be sending out communications to join that. And then we'll also be canceling our online or our Poverello Center neighborhood meeting this month. And instead we'll be hosting a public meeting or public hearing for the Veteran Transitional Housing Project. So we'll be hearing public comments from the community as a whole about our purchase of the Clark Fork Inn apartments and that project. And that's in conjunction with the county and some grant funding around that project. Jesse, if there's anything else.
Yeah, that'll be on March 21st at 5:30. It'll be an online Zoom call, so we'll be sending more information about that. It'll be a chance to express, we encourage supporters, of course, to be there and talk about kind of your view of the work that we do, specifically around our veterans programs. And it'll be an opportunity for public to give feedback about that particular project as it moves forward. So there'll be public notice going out about that and a lot of messaging on our side.
I have a question. Usually you have a Zoom program once a month, don't you, dealing with the Johnson Street shelter. Is you going to have one coming up here soon in a few days?
Yes, that's on Thursday at 5:30.
Of this week?
Yes.
Yeah, I got to put that on my calendar.
And I think I sent out an email for it this morning, but I might have missed you, Jim. So let me double check.
Sarah, I just have one more question. I try to do what I usually do when I bring a donation to the POV last week, and it said you can't go in that door that was facing the old YWCA. So what is the process now for bringing donations?
Yeah, that sign is primarily for our clients that they, use the front door because it's just easier. The front desk staff are better able to manage that. So if you do want to come through the back, it's probably best to call the front desk.
I've tried that, and sometimes you just can't get through. That makes it difficult. I did stop in front today because I was worried about traffic stopping in front, but
yeah,
Typically they will answer if you do knock, but it is just going to be,
Yeah.
we're going to have a better response if you come to the Broadway front
And
door.
Marilyn, that's a good piece of feedback. Let us check in with the direct care staff. I think that they've changed some of their procedures, which might make it challenging for folks to get those donations in for that back door. So we'll make sure to follow up with them and see if there's a better system to get folks informed if they're dropping off a donation. In general, it is best to just try to call ahead a little bit just to give them a heads up that you're coming. But the hard part is that direct care staff are running around all the time, and so it can be difficult. We are hopefully going to have a staff person focused on those in-kind donations starting this summer. And our hope is to really dial in those processes and make that a lot better. It's just one of the challenges we have of around capacity and stuff around that. But we apologize that was a hard.
No, it wasn't a big problem. I just wanted to know. I was thinking also it might just be useful to put some information about drop-off donations in a newsletter if you send out a newsletter.
Great. Yeah, we'll absolutely do that. And I think that we could probably put a sign up there too about what to do if the people aren't coming to the door. So we'll work on that with our friends on the direct care staff and make that work better. So thanks for the feedback. We really appreciate it.
Oh, Sarah, I just found on my calendar, I do have you listed for Thursday.
Oh,
for the
good.
Johnson Street, yeah. And it's gonna be at 5:30, not midday like today.
Correct, yes. And then the last thing I wanted to just call to everyone's attention is our opportunities to support the POV. So Aicia touched on some of the volunteering opportunities that are specific to Med Respite. So if you are interested in getting upstairs and cleaning, we're always welcoming those people that are looking for that kind of opportunity. And then we're also continuing to try to meet our needs of sack lunches with sack lunch production. So if you're interested in either assembling sandwiches for those in our kitchen or in another commercial kitchen around town, or donating sack lunch supplies, feel free to reach out to me or look on our website. The volunteer page has a connection to our portal and that email. And then if there aren't any other questions, I think we can wrap it up today a little early. So thank you all so much for joining us.
I threw my email in the chat if anyone does have any questions they find out about later on.
Alrighty.
Thanks, everybody.
Yeah, is there a connection between Meals on Wheels and the food bank and you guys? You have any? Are you connected with the food bank or Meals on Wheels?
So we work closely with the food bank, Jim, mostly through our food rescue program. So we have a food truck, that goes around to different restaurants and grocery stores and picks up food that's about to expire.
Yes.
And that's makes up a bunch of what we actually serve for meals and stuff at the POV.
Yeah.
But we do not work with Meals on Wheels. That's a different program, and
Okay.
not one that we worked with in the past.
Okay. Okay.
Cool.
Okay. That's
All right.
cool.
Thanks a lot, everybody. We'll see you later.
See you later. Thank you.
Emma.
Bye-bye.
Thanks for having me.
Well, Emma, thank you so much. We really appreciate it.
Yeah, absolutely. Thanks for having me. It's nice to put a face to names and see all of you guys.